The two biggest killers of children at the moment are pneumonia and diarrheal disease, and pneumonia is by far the biggest killer.
Almost everyone is stunned to understand that 25,000 children die every day from preventable causes, and more than any other single cause, pneumonia.
Pneumonia is a neglected disease. There is a perception that pneumonia is a solved problem. It's not a problem anymore. That this is the killer.
Science has given us the technology to prevent and control this disease.
The most simplest message that you can deliver is that pneumonia kills children and that we can prevent it.
It's essentially the low-hanging fruit of global health. We have safe, efficacious vaccines against a terrible disease that just aren't being applied. So not only is it a huge disease, but it's a problem with a solution.
In the rich parts of the world, our children are protected through vaccines, and so we rarely see our children dying. Whereas in the poorest parts of the world, awareness is not of the same level because we don't have the effective preventive remedies until now.
I'm a parent. I got 2 daughters. They both got pneumococcal vaccine. Why should children who are just happen to be born in an African country be denied access to a life-saving vaccine?
HIV vaccine. It's coming to my country after 2 decades. It's being in use in the developed part of the world. We want these vaccines to this country, to the children who cannot pay for it at real time.
Strengthening the delivery of routine vaccines and the introduction of new vaccines.
We must invest in vaccines and bring them to children. You prevent disease, you prevent hospitalization costs, you prevent disruptive effects on family life, you prevent growth faltering.
Pneumonia is preventable. Pneumonia can be prevented by better nutrition. Pneumonia can be prevented by having less pollution inside the house.
There are ways of preventing pneumonia in children to improve nutrition, breastfeeding and vitamin A supplementation.
Breastfeeding, especially exclusive breastfeeding in the first 6 months for the young infants. Improvement of nutrition generally.
Lack of breastfeeding would be a very important factor. We need to give them foods that are rich in iron, rich in vitamins.
Improve case management.
The mothers, they cannot recognize pneumonia, so they are not coming to the hospital. When they're coming to the hospital, it's really late to survive. It's not easy for them to come to the hospital. There are transport issues, different issues are there.
Large segments of population do not have access to health care, or they do not access health care because of lack of education and understanding.
Involving the parents, educating them.
All you need to do is count a full minute with 50 breaths. That is already a sign.
Kahapon, gin-check ko ang pag ginawa, butot normal ay dapat 40 ang normal mo. Tinagdangat ng 43, butot abnormal din. Tinangnan ko madaran to sa midwife para i-check out. Itawan ako kabulong, mapagtawan tangan nga ka first dose.
We have thousands of community health workers out going village to village every day with very, very simple solutions to the pneumonia curse.
If you care about children surviving to the full potential, that you have to care about pneumonia, in preventing pneumonia and preventing pneumonia deaths. We need to get our act together in getting this message across. We need to be able to convince everybody around that has to be the major focus for everybody. There's no other way around it.
World Pneumonia Day would give us an opportunity to focus on children's health, and pneumonia being a major part of it.
And it will be my pleasure to be one of the people that will help people to know about the World Pneumonia Day.
Young children die unnecessarily. It's a no-brainer, quite frankly.
No child should be allowed to die for lack of something that is easily delivered and could be afforded by the global community.
I'm delighted that caring people from New York to New Delhi are gathering together today for the very first World Pneumonia Day to bring solutions to this tragic situation that results in the deaths of millions of children every single year.